Welcome to the Path to Be Well podcast, a podcast about being well. I'm Doug Rawson. Join me, Mark Tremblay and Paul Calori each week as we answer your questions with the sole purpose of helping people who suffer from a chronic medical condition in considering the safe use of cannabis so you can have a better quality of life. In this podcast episode, Mark and Paul bring awareness to sublingual dosing, taking your medicine under your tongue, a review of some situations, why clients prefer this dosing method, as well as advantages and disadvantages are discussed. Calculating dosing can be difficult for some with inconsistent unit measuring. We have created a dosing calculator to help you with this, which you can find at mydose.co. We want you to have confidence in your choice of treatment with cannabis. For more information about sublingual dosing or consumption methods, you can download our infographic and get free resources delivered to your inbox. Visit weedwell.co/map5 or send us a text to 705-805-8264 and with the message #map5 to have a link sent to you via text message. If you have a topic that you'd like covered in a future podcast episode, please send us a text at 705-805-8264. If you'd like to be included in our community and be the first to receive updates about future podcast episodes, again, send us a text to 705-805-8264. And with the message include #podcast or the emoji microphone, and we will ensure to update you with each new episode. Now, let's join in on the conversation.
Hello, everyone. Thank you for joining us. My name is Mark. I'm with Weedwell, and today I have the pleasure and the honor of having my very good colleague and friend, Paul Calori, who is joining us, well, actually every Thursday for our learning and knowledge session. Paul, why don't you explain to our audience what is learning and knowledge session?
Well, we're trying to take our little tidbits of knowledge and obviously some research mixed in and try to present it, in a palatable way to the average person. But we're taking stuff from the previous clinical setting that we all shared in. For me, a few years, we would say, and for you and Doug, certainly a lot more years. We're kind of pooling together a lot of that knowledge, again, with some studies and book knowledge, if you will, presented in a fun way in small doses, if you will. You can take away little nuggets of information and add that into your treatment plan.
Very good. Every week it's a different topic, and this week happens to be sublingual dosing.
Sublingual dosing. And so we'll start with manifesto, and then we'll work where it fits in our roadmap in just a second. Our manifesto is today I have confidence in my choice of treatment with cannabis. Pretty self-explanatory. Some people come to that after long-term research, if you will. Others are aiming for hand-holding, like in a clinical setting, as we've previously provided. And others come to it on their own, whether they've self-medicated for years and figured out that something's worked for them or their symptoms, and they've come about it that way. But in any event, you end up developing that confidence in the cannabis as your medicine. We're in Be Informed today, and Be Informed is kind of the midway point on our roadmap of our 5 steps. And Be Informed is I am now informed and have a clearer understanding of the types of cannabinoids and how I want to consume my cannabis. I now have a treatment plan that is focused on me. And sublingual dosing is the method of consumption in that statement that we're talking about today. I just want to take a step back and we'll delve into the roadmap itself and exactly what it means. And I think your intro leads into this very well. What is the knowledge and learning session? So like the knowledge and learning session, we're taking our experiences with clients over many years, and we've pooled that knowledge into a roadmap, as in what works. What have we seen work for individuals? We'll call it a roadmap. You could call it a blueprint. We refer to it as a roadmap. Now, the roadmap itself is a free resource, weedwell.tips. The roadmap exists there. We've also done a podcast episode, Doug, yourself and myself. And those steps I'll get to in just a second. But we've gone step by step through that roadmap and little things that and resources that exist at weedwell.tips that assist you on your journey. So what it is you see all of what you can do, what you can add into what you're doing now, hopefully to bring you further along in your path to wellness, along your journey. So be clear, we've referred to in many episodes previously, is the first stage, and where you're trying to get clarity on your health, doing a health selfie. Be aware when you try to really formulate a health goal, something you want to work towards. As I said, Be Informed today is about cannabinoids. When I gave the first statement there, what Be Informed. So THC, CBD, how you may use them as in how you'll consume. So today's topic ties into that perfectly, sublingual dosing. Be progressing when you actually start and assess treatment, and be well further along when you start introducing other medicines, other treatments, other therapies, and you really begin to look back to where you were, and then repeat the process where you're looking further into the future to where you see yourself next. And so I wanted to bring that up. Episode 43, podcast.weedwell.com, goes through that in detail, and that's beyond the discussion today. But I really wanted to highlight that and where this fits in and why do we bring up the roadmap? Well, the roadmap's there as the blueprint to get your results. And so it's a very good starting point. Weedwell.tips, have a look at it. If you want some more information, as I said, we have the episode 43 podcast at podcast.weedwell.com, where it gives you a lot of details and kind of the baby steps in each one of those we'll say big steps. So that's where the roadmap fits in. And we're in Be Informed right in the middle today with sublingual dosing. For those who are not aware, sublingual dosing is a method of cannabis consumption where you'll take a dropper or a syringe like this without the pokey part, and you drop cannabis oil underneath the tongue. And that's the method of dosing that way. It's a really simple method. And honestly, when I started working at the clinic, I'll give you guys some credit here, I had no idea about it, but it seemed that you guys had an awful lot of clients who were dosing in this method. Of course, I was familiar with smoking, and I think most people are, but it seems to me you guys were really at the forefront with the sublingual dosing. Do you want to say a little bit about that, Mark?
Yeah, and you're absolutely right and accurate with that statement that we were at the forefront in the industry, in Canada anyways, at the time. And we were actually, I believe, influencing the regulated licensed producers in Canada, those that are responsible for cultivation and distribution of the cannabis under the regulations of Canada. And just because of the background of Doug and Dr. Adelberg at the time and the value that they saw with sublingual dosing, is that we really put a lot of emphasis. And I have to say, it was a little bit of a journey in the sense that people would look at us a little funny at times, like, what are you talking about? Cannabis, where you normally smoke. I may have seen it, using a vaporizer, but under your tongue. So we were, at the forefront, I think, leaders in that for a long, long time. But we were seeing the results. We believed in it, started introducing it with our clients, and then we saw the results. And I know you'll touch more on some of the benefits and all of that. So I'm not going to take away your thunder there, but I'll leave it at that.
Thank you, Mark. So back to the roadmap, and let's present sublingual dosing as we're going through the roadmap, and let's tie it all together because, really each part of that roadmap, each of the 5, we'll say, phases, kind of ties into each other, and one affects the other. And, while they stand alone, there is some interdependence. So sublingual dosing in the context of Be Clear, and this is, as I said, the health selfie area, if you will. If you're treating a symptom that's there nearly all the time or all the time, sublingual dosing might be for you. Well, the only way to identify that is really delve into the symptoms and how you feel and when you feel it. And so let's use the example of pain. Pain is, something that can be coming and going, or like I just said a moment ago, there all the time or nearly all the time. And so you would gravitate or would want to at least introduce a long-acting cannabis medicine. One of the ways to do that is sublingual dosing. So having that background on what you feel, when you feel, and really specifically get a detailed health selfie really begins to lend itself to how you want to consume it. Often in the clinical setting, what we found is the person came in with an idea, or at least they felt they had an idea of where they were at, and it was, what do I take for this? And when you back up and actually get the details in the be clear, it kind of directs you into what you want and how you want to do it. So that's one part. The other part is being, and this is more a little be aware, but being cognizant of pre-existing medical conditions. So what does that mean? Often in the clinical setting, we met people who had given up smoking. And so the first thing out of their mouth is, I don't want to smoke the cannabis. I gave up cigarettes 5 years ago, 10 years ago, or whatever. For other people, they come with pre-existing lung conditions. I have COPD, I have asthma, chronic bronchitis, what have you. And now I want something that isn't going to involve the lungs. Well, when you have an understanding of those conditions and how it might tie into your method of consumption, we already know we've eliminated one of the 4 main methods of cannabis consumption. You're not going to be an inhaler, and that's okay. And now you can work your way around the other 3 and see how they fit. So you see, really, this roadmap and doing the legwork at the start of the journey now begins to dictate where you might be as you start to introduce cannabis. So that's kind of the be clear, be aware discussion insofar as sublingual dosing goes.
And that's why that stage, be clear, is so important, actually vital, really, to your treatment plan moving forward, because it's foundational. It's going to be building blocks after that. So you need that good, strong foundation. Very good point, Paul.
Now we're in be informed. So the actual cannabis type, if you will, insofar as cannabinoids go, and how you're going to take it. So sublingual dosing is one of the 4 main methods of cannabis consumption. At WeWell.com, we have a blog, an infographic, I believe a slideshow as well, that really delves into all 4 methods and talks about how they'll fit into this type of treatment plan or this based on your individual condition and what you're trying to treat. So that blog exists in weedwell.com. Now, the details of dosing, it goes underneath the tongue. We introduced that already. And what we recommended over our years in the clinic is hold it underneath the tongue for some length of time, 30 seconds. And over time, even that's varied. And the rest will be swallowed and then go through the gut and be processed that way. So some absorption will happen in the mouth. Research-wise, it's variable on how much that actually is. But we do know that it will go through the gut and be processed that way. So you have one of 2 different methods. What seems to be the case is fatty foods in the belly may help absorption. The rest that goes down into the belly may help with absorption. But we have issues with accuracy of dose. So what I do know, when I draw this up halfway, it is at 0.5. I know that's going into my body. What we don't know specifically is the amount that's actually getting into the bloodstream to do what it is that you want to do, relieve my pain, relieve my anxiety, or whatever. And that's we'll say the factors of what's in your belly, what did you consume shortly after, how long did you hold it in your mouth. With regards to that, what we do know or have seen over time, and when we do our check-ins with clients, Mark, I've taken this dose for 3 weeks and it's not doing anything. Are you holding it underneath the tongue? Well, no, I thought I just had to swallow it. It doesn't taste very good, so I just wanted to swallow it. Try holding it underneath your tongue and we'll check back in a couple more weeks. How does that sound? Good. Hey, Mark, this stuff is working great. And I'm sure you've had those conversations with clients as well. Just that slight tweak. And so in a therapeutic sense, if you're getting that much of a reaction just by holding underneath the tongue for that 30 seconds or whatever, we know something's going on, but it is an X factor, if you will. So to continue that, once we get to the gut, we want to talk in terms of bioavailability. Fancy terminology for how much medicine that went in the syringe and in your mouth is actually getting into the bloodstream to do what it is that it needs to do. And all medicines go through this process. So it's not just cannabis. So with regards to sublingual dosing, it has low bioavailability as compared to, say, an inhalation method, which, really has readable access to the bloodstream through the lungs because you have great blood flow to the lungs. That doesn't mean it's a bad method of consumption. It's just something to take into consideration. What we do know, though, is it acts much longer. So we've talked in terms in previous weeks, recent weeks, of THC and driving. And with the longer onset of action, when we had this conversation, we were quick to point out when they talk about 6 hours, we're not really talking at all about sublingual dosing. It's more inhalation because it's much shorter acting. And so when you go to try THC in a sublingual form, be aware that it's going to act at least 6, sometimes 8 hours. Often what we'll hear in a clinical setting is, I tried the THC dose at 10 o'clock right before I went to bed, but I woke up feeling groggy. I didn't think I could drive to work. And so for that individual, it's at least 8 hours. Well, the next thing is don't drive to work, number one, but let's push back your dose in the evening to maybe 8 o'clock so you wake up feeling the way you should be to drive a car. That's a lot of stuff, and we can kind of backtrack a little bit on dosing, but that's all about the dose from the time it hits your mouth to, what action you can expect to have and for how long.
In addition to the acrid dosing that you've already touched on briefly in the syringe, you know exactly what you're getting, providing, of course, that you know the concentration of that oil that I'm sure you'll talk about. But there is an efficiency to be derived from that. And countless clients that I have served in the clinic since over time who were consuming X amount of dollars smoking cannabis were able to really hone in on what would be a more accurate dosing and more effective results, longer lasting, all of that. And they would come back and report that there was an economy of scale that they were experiencing just based on that. Well, first of all, we do know that from igniting a joint, a cannabis in a rolled form, is that a lot of it is actually, gone up in smoke and not into your lungs to be absorbed. So there is a inefficiency there. You've paid for that product and you're literally wasting a lot of that product. So from that perspective alone, those who started dosing, although it was a transition, really found that there was benefits in addition to feeling better and longer lasting, just an economy as a result of that.
Very fair point. And we'll touch on that more in just a moment here. One thing that often we mention in a clinical setting is one way to start at least your day, if you're dosing during the day in cannabis, is one of the first things you do when you get up, take your dose then. Because generally speaking, we don't get up in the middle of the night and eat. So you're starting right on an empty belly. At least that way, it's consistent every single morning. If you're doing it every single morning, you'll get used to it. That being said, as you dose with cannabis oil underneath the tongue, you do get used to the effects and you know when it's going to start because there is a latent effect there, 60 to 90 minutes. But then, as I said, you're going to get a good 6 to 8 hours. When we talk about symptoms that are there all the time or nearly all the time, this long-acting dose is what we want to kind of keep things in check. But to your point, Mark, and we'll move into Be Progressing, where we actually do cost analysis. And often, there's a discovery for people, and they'll come back to us and report exactly what it is that you said. But getting to that dose in that oil form, and then you multiply it over days, and you figure out how much is in the bottle, they are inevitably going to save money. as compared to any inhalation method. So that cost analysis does exist in the be progressing part. But the other part I wanted to talk about there is titration, or adjusting your dose. And so what we do know with a syringe, it's very accurate in tenths of like this is a 1 milliliter syringe. So you can go to 0.1 to 0.2 to 0.3. That's very accurate dosing. It's a lot more difficult to do, we'll say, in a bong or a vaporizer. You can put about the same amount of flower in, to a certain fill point, let's say, but you're still going to be affected by the variables of how deep you inhaled, how long you held it. There's a lot more variable here. Not to say you can't get therapeutic effects, it's just there's more variables. When you go to titrate a dose in a syringe and you want to move from 0.1 to 0.2, that part at least is very accurate. You just draw up to the 2. So titration is very easily done there. And over time, what I noticed is you could get into conversations with clients and they would know I'm at 0.5. And that was their dose. They had been on it for weeks, if not months, and whatnot. So it becomes easy that way because it's instinctive. I guess it feels more in that way like, we'll say, a typical medicine. I am on 500 milligrams of metformin. I know that, and I have been for years. So it kind of mimics that. So titration, or the ability to adjust your medication, is quite easily done in syringe form. So Be Progressing takes into the cost of analysis, as you said, quite often, just about always. If cost is what you're really, really focused on, you're going to find that oil dose sublingually is going to be better bang for your buck than any other method. And then, as I said, the accuracy of the titration, how you can really, really take micro or baby steps up.
Often, Paul, a client that's been titrating and have found a noticeable degree of relief will continue to titrate in increments that are predetermined and at various intervals. And then what we typically, they're going to say, well, how long do I keep titrating? Well, we say till you found that therapeutic relief. Not necessarily that we were striving for, but at some point, you're going to get the max that you can get out of this here. So, for example, and this for the benefit of the listeners, is that if you are currently at 0.8, have been there for about a week, and you observe that there's really no additional benefit from where you were at 0.7, then that would be your, call it, dialed in dosing at 0.7. There's no sense in taking more because your body is simply not responding to it. And as I've heard you say a few times, and perhaps our listeners have said, if your clothes gets clean with a half a cup of laundry soap, giving it 3/4 is not going to make it any cleaner. Same kind of scenario. I knew I'd get a chuckle out of you for that, Paul.
It's true. And so, I would be remiss if we didn't mention start low and go slow. That applies to all cannabis dosing, but especially in the sublingual form. And the situation that you just mentioned really ties into this. We want you, we recommend, I should say, that, maybe your starting dose was 0.3, and it will take you 4 steps to get to that 0.7, and then the 5th step to really figure out there's no added benefit at 0.8. But it's twofold. Cannabis oil is highly concentrated, number one. So you don't, especially in terms of THC, you don't want to take too much on the first time because it's going to sour you and turn you off from continuing what could be a potential excellent treatment. And so you don't want that negative effect right off the bat. By starting low and going slow, we're talking about cost analysis, cost effectiveness. If you start at 0.8 or 0.9, you're taking a heck of a lot more medicine that you would find out that you don't actually need. By starting low and going slow, you inch up gradually. You're taking a lot less medicine till you get to that sweet spot or that right dose. That's Be Progressing in a nutshell on our roadmap as it applies to sublingual dosing. Finally, we'll go to Be Well. And how does that fit in with sublingual dosing? And what are we looking at there? Let's use the example of pain. Pain that's there kind of all the time or nearly all the time. And so based on this conversation or other conversations that you've had or research that you've done, you found, hey, a long-acting cannabis may be right for me. And you try and you go through your titration process and you figure out, let's use your example, 0.7 is my sweet spot. That's great. And so at Be Well, you kind of have a handle on that. You know how it's working for you. You know the time of day you're taking it. You're really not adjusting anything as it goes for your dosing at that point. But what you do notice from time to time is these, well, we'll say pangs of pain. Like it really ramps up, and waiting for that kind of oil to kick in, or that oil is keeping it in check most of the time, but not all the time. And this is when you would actually now consider, hey, maybe there's a different method that I can begin to bring in. And this type of method of consumption would be an inhalation. And, you would evaluate, going back to be clear, what's my lung health? How will it fit into my treatment plan? Be aware, how does it fit into my treatment goals? And you see how you kind of do the exact same process again, and you get to the conclusion that inhalation is right for me, but I'll just do it a little amount of time because of A, B, and C. And, as opposed to introducing inhalation at the exact same time you're doing the sublingual dosing, it would be hard to figure out what's doing what and what's keeping this in check and what's working well and what's kind of Try one, in this case, the sublingual dosing. And once you get a handle on that, that's when you begin to, in that Be Well phase, begin to introduce new things. We've talked about that before in terms of complementary medicine, but your complementary medicine in this case can just be a different way to take it. It could also be a different cannabinoid. I know I was only using CBD to begin with. I got a handle on that. I'm at 0.7. I think maybe introducing a little THC at night might help me, but I only want a tiny amount. And, maybe the method of consumption stays the exact same, but it's the cannabinoid that changes. And that's how sublingual dosing relates in Be Well on our roadmap.
Hi, Doug here from Weedwell. I wanted to hop in here for a moment as we're excited to share with you how we see our Facebook community grow every day. I want to extend a warm welcome to you in joining our community to get tips, tools, and resources while collaborating with others to support you on your health journey. Look for us at weedwell.group.
Prior to the treatment with sublingual dosing, and as you mentioned, in this case, CBD for a number of conditions, over time, you're really bringing your baseline higher than what you started with. And then the complementary medicine, in this case here, still cannabis. And as you said, Paul, maybe a different cannabinoid. So if you're doing CBD to increase your baseline and then introducing a little bit of THC as required, could be very, very beneficial. So as a breakthrough, so there's a significant amount of pain coming around so that the THC and its quick effect, or you're feeling a migraine, an onset of a migraine coming up, then your joint or your vaporizer would be good. But for the health reasons, as you've said, try to not make it a regular method of consumption, but more for the exceptions along the way. Now, kind of tying in with that, Paul, going back a number of years where we were helping clients that came to see us transition from smoking or vaporizing heavily every single day just to maintain at best, it was a big transition for some of them. They become reliant on the joint and the habit of doing this. So I was quick to say, we're not saying don't do the joint anymore. If you find that it's therapeutic, even the motion or the lighting up or the aroma of it for you does something that's therapeutic, we're not saying don't do it anymore, but keep it down to moderation. And maybe that's your little nightcap, as you call it, or your little treat of the day, is to be able to go back to something like that brings you, therapeutic relief.
Really, Mark, it's a very fair, valid point. What you've presented is kind of we'll say in the opposite way, where, we talk through sublingual dosing as a topic today, as we'll say the primary care method or consumption method for your treatment plan, to adding in an inhalation. And, it's not even inhalation. It could be a topical. Some people will gravitate towards gel caps as well because they don't like the cannabis oil taste. And so we talked about morphing, we'll say, in that way. All you've really done is switch the other way. So your experience you pull from is you met numerous people over the years that were self-medicating, and on the street, if you will, or dispensary or wherever they came from, it was a dry flower. So they were always inhaling, whether smoking like a joint, like you said, or vaporizing. And all you guys had done over time is introduce that secondary method, like you said, not necessarily that you gave up the primary method, because whether it was habit or therapeutic, as you said, all you're trying to do is augment or assist. And, for some people, they did a bit of both. For some people, they never really got onto the oil, in all honesty. And for some people, they did a full 180 and we're only using oil. But it's the exact same thing. Once you get to that point for those individuals, the dry flower strain or strains, I use this one during the day or this one in the evening, all they've done now is add in a different method of consumption insofar as the oil goes. And, that would have been your conversation, I imagine, in 2013, 14, 15, and for quite a few years since.
Paul, just because in the likelihood of someone listening either live today or at a later date, you've said because for someone that's been self-medicating for a long time, that they were pretty much limited to smoking and smoking a joint. Some of them would say, hey, I've been making butter for a long time, or I've been doing edibles and making my own mix, right? So there is that component of that as well. But by far, the most common was, smoking a joint. We've all seen that.
For sure. And it's interesting when you start introducing, and even now there's more vape pens and stuff, like way more available out there through legal channels as well. I guess the base point is, in terms of sublingual dosing today, if that's what you're going to start with, that's a great start. Don't try to do too many things at once. We've said this in the context of other things. I want to introduce cannabis, but I want to get off my antidepressant on the same day. Don't do too many things at once. Take your time. I think that's, if we take a general concept here, do one thing at a time. Figure it out, especially if you weren't a self-medicator and you're just figuring out this cannabis thing. Yeah, you're new to it. You're new to CBD. You're new to THC. Figure it out, get your feet under you, and then, as that begins to work or begins to give you some therapy, then start looking into other things, add in slowly, start low and go slow. We can't emphasize that enough as far as consumption goes with cannabis.
Sublingual dosing, and we know it to be effective, all the things that we've already touched on. Another obvious benefit is that it's very discreet in that, you could be consuming, almost anywhere, and there's no odor, from a vaporizer or from smoking. So it's very discreet that way. And I know that many of our clients, as effective as the syringe is, for all the reasons that you mentioned, the accurate dosing, but if they're out and about, they might bring a couple of capsules with them, because it makes it even simpler than trying to, dose from a bottle and a syringe. So the discrete part is a huge factor for many people.
That's a great point that will kind of tie together something else you said earlier, Mark, about knowing what's in the bottle as far as concentration goes. Quite often in the clinic setting, we would see clients that started with an oil and got to the capsule, as you just said, whether it was because of the taste of the oil or they just wanted something that it was easier to carry, easy to take on the go, et cetera, et cetera. And so one of the limiting factors, we had a conversation about this a couple months ago, is those gel caps are set in specific increments, 2 milligrams, 5 milligrams, 10 milligrams, whatever the company is offering. So that milligram is very important. Now, that does not equate to a certain amount in a syringe. Like 0.5 doesn't mean I take 5 milligram gel cap. What it does mean, though, is you need to look at your bottle. So cannabis oil comes as a concentration, milligrams per milliliter. And so the other thing you'll see is a total number of milligrams in a bottle. So it kind of says the same thing. Often from our licensed producers, we'll say in Canada, we see something like 20 milligrams per milliliter. That's a concentration. If your bottle's 40 milliliters, you might get a total concentration of the bottle, and that's simple. 20 milligrams times 40 milliliters. That's your total concentration, okay? So in any event, let's use the 20 milligrams per milliliter example. If you know you're a 0.5 person, because you've been taking that dose for a long time, say of CBD, and so we know a full syringe, a full 1 milliliter, is 20 milligrams. 0.5 or half of that would be 10 milligrams. And so now you can figure out your dose in the gel cap form as being 10 milligrams. But that's how you would have to come to the 10. And that's why that concentration on the front of the bottle, it actually means a lot. So, again, if you were a quarter of a syringe, you would only be a 5 milligram dose.
And for someone that's good with math, and not that it's complicated, but you know what, with calculators and our phones that have calculators, I think we're not exercising that part of the brain to do the math so much. So we have come up with a very clever little device. It's the dosing calculator. So what you would do is apply the concentration and to get the equivalent in the milliliters that you're looking for. So Paul gave the example of half a syringe, maybe one gel cap or 2 gel caps, depending on the concentration of the gel caps. Paul also used the example of 20 milligrams per milliliter is a common concentration. But more and more, we're seeing variables there from, less to a lot higher concentration, up to 50 and even beyond milligrams per milliliter. So that could be very confusing for someone who has to adjust based on the product that they've received. So we tried to take the guesswork out of it with a dosing calculator, and you could find, at least online at weedwell.tips, in there you'll find a dosing calculator on paper. But Paul, over to you. The dosing calculator that they could even reach online.
Mydose.co has 2 boxes you need to know to figure out what it is that you need to put into your syringe. You need to know the amount of milligrams that you take, and then you look at the bottle and you figure out the supplied dose. Those 2 numbers go into our calculator. Out comes the amount you need to put in your syringe to match that dose. Mydose.co is the online calculator.
One of my favorite, Paul, as you know, and thank you for being able to, clarify at least the link to get the one online, mydose.co. And again, for those that would rather see a chart, weedwell.tips, you will find the dosing chart in there.
I think this has been a pretty thorough discussion on sublingual dosing, but more importantly, how it relates to the roadmap and each step along the way. We started with introducing the roadmap and what it means and where it comes from, and kind of the blueprint for getting results, the blueprint or the roadmap for helping move you along your path to be well. The sublingual dosing has important factors in be clear, be aware, in formulating what it is that you're trying to treat, what symptoms are there all the time or not necessarily all the time, and then really how it fits into your health goals. Be informed Sublingual dosing is but one of four main methods of cannabis consumption, the others being edibles, topical, and inhalation. Really all four do have a potential to be a part of any treatment plan, but it depends, again, on that prep work you did. What is it that I'm looking to treat, and what is it that I'm looking to be better or get better? And from there, you kind of derive where you fit and what you're going to take and how you're going to take it. With regards to sublingual dosing, there's definite advantages in small increments, inching up your dose to where you find your sweet spot. And then finally, to be well, where we see there might be a place for other methods of consumption, like an inhalation. And of course, as we mentioned already, you might come from inhalation and you might look to be introducing sublingual dosing or topical or whatever. And really, this topic, as you can see, it fits all the way along your roadmap. And you might have a handle on 2 or 3 of those things, of the 5 things that I just said. And that's great. That's where you are on your path. And we always say, your path is your path. Your journey is your journey. But the roadmap, as I said, as a template, you can go back and kind of fit in what it is that you're looking to do, or where you may be lacking on, we'll say, those 5 steps. And maybe you'll find that will help produce some results for you.
Paul, in consideration of the demographics of our clients, which is somewhere around 50 and up years of age, sublingual dosing was really a breakthrough that allowed us to serve so many more clients, because otherwise, with the limitations of dry cannabis, smoking or vaporizing, many of those would not have even considered cannabis as an alternative to treat their condition. But sublingual dosing meant they didn't have to have a joint, and for some of them, it's because it's a habit they had given up a long time ago. They didn't want to risk, going back to that. So there was a huge breakthrough, and it felt more like medicine. It, came across as medicine. And for those that were perhaps reluctant to even consider cannabis, this made it a little bit easier. Their eyes or their minds were a little bit more open to it because it came in a bottle, and that is something that they were already familiar with and probably more comfortable with as well. So for us, definitely a breakthrough.
That's an excellent wrap-up point. The only thing I could think of to add to that as you were talking is that stigma that came with the smoking over the years to that client of that age. I would just leave it at that, because I think that was a fantastic point, Mark.
So for next week, what could our listeners and viewers be expecting for the learning and knowledge session of next Thursday?
Next Thursday, we're going to call it Your Treatment Plan in a Circle of Care. And so there's lots of, again, across the spectrum of our roadmap from Be Clear to Be Well, how your treatment plan fits in with kind of everything else. And for some people, all those different practitioners and specialists and pharmacists, and how your treatment plan with cannabis fits into that.
Very good, Paul. I'm looking forward to it, and I would venture to say that our listeners would be looking forward to it as well. So, Paul, a good session again today, and now it's my turn to do. I've done my little wrap up, so now it's time to do our disclosure, and that is that I'd like to remind our audience that these information sessions are intended for individuals who are generally in good health, are generally well-adjusted, are functioning effectively, and are not in need of medical treatment. That's including treatment for mental health disorders. Now, these information sessions do not involve the diagnosis or the treatment of mental disorders and does not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. So it is your responsibility to seek independent guidance from medical professionals to the extent that is necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those of you who have taken some steps in improving their quality of life, congratulations. And as Paul's already stated, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So on behalf of my colleague Doug, who's not with us today, and Paul and myself, we look forward to the next time that you join us. And until then, be well.
Thanks for joining us this week on the Path to Be Well podcast, a podcast about being well. Make sure to visit our website at weedwell.com, where you can subscribe to our show so you never miss an episode. While you're at it, if you found value in this week's show, we'd appreciate you sharing this podcast or leaving a comment or rating. We look forward to you joining us next time. Until then, be well.